Welcome to Practical Talk Time. I'm your host, Sandy Robel, and today we have a very special program on Firstline Therapy, and that's going to be explained to us by two doctors, Dr. David Silver and Dr. Christopher Spark. Welcome to the show, Dr. Silver and Dr. Spark.
Thank you, Sandy.
Dr. Silver, I've been told, is an osteopath,
Correct.
whom I've heard of osteopaths, but I have no idea what they do. And Dr. Spark is a chiropractor.
Yep.
And I think many people are familiar with chiropractors. Let's start with Dr. Silver, since I don't know anything about osteopaths, and people I talk to either say they've never heard of it, or they heard of the word and don't know what it means.
An osteopathic physician is a physician. He or she takes the same courses as a medical doctor does, plus we do manipulation. The other difference between a DO and an MD, a medical doctor, is DOs, doctors of osteopathic medicine, we believe in the holistic approach. We treat the person as a whole collection of systems in the body, not just one organ system.
Mm-hmm. Now, how would that compare to, let's say, a naturopathic doctor? Because I know they do a little bit of chiropractic manipulation. But they're not a medical doctor.
Correct.
They use natural products.
They use natural medicines to treat their patients.
You know, that naturopaths, unless they have another degree, at least as far as I'm aware, in Connecticut statute, aren't allowed to do manipulation. So there may be a naturopath and a chiropractor at the same time, or a naturopath and an osteopathic doctor.
I only know what I was told. I do know that naturopaths aren't recognized in New York State, but in Connecticut they have to be licensed.
Yes.
Now, what about an osteopath? Are they recognized throughout the United States?
Yes, osteopaths are recognized in all 50 states in the United States of America.
Why is it that we seldom hear of osteopaths?
Because we are a smaller group of physicians rather than MDs, and most osteopathic physicians go into primary care. So they're internal medicine doctors like myself, family practice, pediatrics. But an osteopathic physician, once he finishes medical school, he can do a residency in any specialty. They're osteopathic physicians, surgeons, ophthalmic, they can be any specialty.
Oh, I'm amazed. I didn't realize
Yes.
that. Is it funding, or why is it not as popular? Why do not more doctors go into that?
I think because it's a smaller group than MDs, that's why we're lesser known. There are fewer osteopathic medical schools in America than MD schools, and they were originally just in the major cities.
And it's a slight philosophy change as opposed to a medical doctor.
Correct.
Who is just solely looking at one organ system or one particular problem.
The specialist, like if I go to a general practitioner, then if there's a problem, he'll send me to a specialist.
Correct.
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 Right? And I know now sometimes they even do recommend going to chiropractors, which maybe 20, 30 years ago, they wouldn't have even considered that for the most part.
Correct.
Dr. Silver, where did you go to school to become an osteopath?
I went to Nova Southeastern. When I graduated 20 some odd years ago, it was in North Miami Beach, Florida. Now it's in a suburb of Fort Lauderdale, Florida.
Mm-hmm. And is your residency the same as a medical doctor, or is it more extended because of a specialty?
After medical school, I did a 1-year rotating osteopathic internship in Fort Lauderdale, and then I did a 3-year MD residency in internal medicine in Philadelphia.
Mm-hmm. So it's quite involved.
It's very involved.
Yes.
It's very involved.
I'm sure our viewers are going to love hearing this too, because we're really not informed or even give it any thought. And Dr. Sharp, you are, not Sharp, Spark, I'm sorry, Dr. Spark.
Thank you.
You're a chiropractor.
I am.
And you work together with Dr. Silver.
Absolutely, yes.
And how does this relationship work? If I'm a patient, let's say I go to your office, Dr. Silver, what would lead me to then become involved with Dr. Spark?
If I see a patient who has a musculoskeletal issue, I turn the patient over to Dr. Spark after examining them, and he will handle it from a chiropractic point of view and manipulation point of view.
And what would you do for a patient when they first come to you, Dr.
Well,
spark?
I would go ahead and do an examination based upon the recommendations of Dr. Silver, and we cross-communicate between the two of us to make sure that, what he is seeing is exactly what I'm seeing as well, or vice versa. After my examination, then a patient will be instructed as far as what I think is the issue, and I will tell them a course of care in what I think that they need to do in order to resolve it. Let's say condition, say lower back pain. Typical lower back pain, nothing going down into the legs, no problems with urination or bowel movement. I'll do the examination and then say, okay, well, you have some joint problems in the lower back, you have some muscle spasm in the lower back, and you have a weakness in the support structure of the lower back. So we need to do some chiropractic manipulation to loosen up the joints. We need to do some manual therapy to loosen up some of the tight restricted muscles that allow us to do that manipulation. And then in order to support and to prevent future injuries, I need to teach you some stretching exercises and some strengthening exercises. And then following also with somewhat of a holistic approach as Dr. Silver does, then if they have any other complaints or we see something else that may need to be addressed, we will discuss that with the patient as well. Say they have low vitamin D levels, or that they really are feeling fatigued and need a multiple vitamin or something of that nature. So we really try to package everything all together in one office. So you can come for basically many, many different types of common complaints and get that taken care of in one office.
Oh, that's very interesting. Any chiropractor I've gone to is just a strict, chiropractic practice, or a naturopathic or specialist. I believe in everybody has their input and are valued in different ways. I'm not someone that would believe that, it should just be alternative medicine, and medical people don't know what they're doing, or they're just pill pushers. So Dr. Silver, I would think you'd be a very unique type person, because Dr. Spark was just talking about giving multivitamins and vitamin D, which I think even medical doctors are doing now.
Oh, yes.
So can you tell the audience and myself how you determine what kind of supplements or medicines people would take? And in general, obviously we're not talking about
Well,
a
if
specific case.
a patient comes in and a common complaint is fatigue, then I'm going to get certain blood tests on them, make sure their kidneys are working properly, their liver, the thyroid, vitamin D. They might have low iron. So we do a complete physical exam and a blood work on the patient to see if anything is out of not in equilibrium in the metabolic sphere.
It sounds to me like you would be doing, just from my experience, it sounds like you're ordering different types of blood work than I would necessarily get from going to a general practitioner. Would that be accurate for me to say?
Correct. I am considered a general practitioner.
Right.
I'm an internist, so I see patients 18 years and up. I see adults. I don't see children.
But I would say that with Dr. Silver's training, it's very similar to medical physicians in those ways of looking at some of the blood work and blood tests as well. But Dr. Silver also has that holistic approach where if you come in with low back, with say a low back complaint again, and he goes and says, well, you have a low back pain, and we notice that your kidneys are functioning fine, but guess what? We have a low vitamin D level, so we want to take care of that as well. Whereas a MD, especially a specialist, will not even bother ordering the vitamin D testing.
Correct.
I do have to say, the medical doctor I'm going to in New York, he did order a vitamin
that's
D. I
great.
think because it's becoming so well known
Oh,
now.
Exactly.
Yes.
Exactly.
Yes, and I do have a low level. When I went to the naturopathic physician, she said, I don't think you'd have to worry. She ordered the test and it was low, but it's borderline, it's right on the border. But I guess that's a problem with us who live in the Northeast.
It is a tremendous problem. I went to a talk about this, and if you live above Atlanta, Georgia, if you live up north, we don't get enough sun. The only time people see the sun or sit out in the sun in Connecticut is June, July, and August, during the summer months. The other months of the year, we're vitamin D deficient.
And I don't always sit out in the sun myself, so
most people should not sit out in the sun for more than 15 minutes a day, especially if you're very fair-skinned.
Right. Very, very interesting. Well, it's a good thing that it's becoming so well known now that people are looking for that. Where before, I think they would have just laughed and said, "Oh, that's a bunch of nonsense."
No, vitamin D has become very mainstream.
So it sounds like, now besides the two of you, what other types of professionals do you have in your practice?
We're basically the two main professionals in the office. We have a lot of support staff. We have a medical assistant, we have an insurance biller, but we're the two
Lifestyle
main.
educator.
Oh, we have a lifestyle educator who handles the Firstline Therapy.
And what is Firstline Therapy?
Firstline Therapy is a program designed to get a person back in a good health from a multiple factor standpoint. We look at what a person is eating, how much exercise that they're doing, what their stress levels are, what their water intake is, and we look at all those factors. Usually a person that's seeking Firstline Therapy is looking for weight loss. And weight loss is a byproduct, but we're looking at potentially body fat loss or dealing with hypertension, high blood pressure, or high cholesterol, or pre-diabetes. Things of those natures, that's where Firstline Therapy really shines.
And we scan the patient. We test the patient for all these medical conditions that are byproducts of being overweight or obese.
It can be, it's just a symptom. There's many possible causes.
Exactly.
Absolutely.
Okay, and we've covered your background and training. What about a food plan? If someone is overweight, now I would hope that everyone isn't just given a piece of paper and saying,
No.
this is your food
No,
plan.
it's specialized according to the patient. And Dr. Spark and our lifestyle educator designs a meal program specifically for each patient.
Yeah, the food plan is one aspect of the Firstline Therapy. So when a person is coming in, they are, in terms of the food plan, we look at a modified Mediterranean style diet, which is high in fruits and vegetables, low in carbohydrates, and we look at a grazed type of eating where you're eating multiple small snacks or small meals throughout the course of the day. And in addition to that are some medical foods that we supplement as well that do some specific things for our patients. Specifically, they stabilize blood sugar, and they also have high amounts of plant sterols to decrease high cholesterol.
And that would all depend upon their blood work and their condition.
Absolutely.
So if someone comes in, they don't automatically get a diet plan that day. It would be preceded by blood work or...
Correct.
Absolutely.
Correct.
Before a patient sees us for their first visit, it's recommended that they've gone through with blood work so that on that first visit we can review the blood work with them and make the determination.
Oh, well, that's interesting. So
Yes, we send them for blood work before they come in.
Oh, okay. I was thinking just the opposite, that I'd go for a visit and then be told what kind of blood work.
No, because we want to start you off on the right foot, and our system is